Happy day to my viewers and my dear students. This is L. Nagarajan working as an assistant professor in the Department of Electrical and Electronics Engineering in MAM School of Engineering, Trichy, aggregated by NAC, approved by AICT New Delhi, affiliated to Anna University, Chennai. And so far I explained about the EEG recording system, EEG waveform origination and propagation of wave from sino to atrio when atrio nodes and the analysis of waveform. So now I wish to explain, I wish to show you a small video that is available in the YouTube for your clear understanding with animation. It will be very useful for you to understand, and at the same time I thank Mint YouTube channel for providing this wonderful video for the students to understand.
EKG interpretation. So before we talk about the actual steps, we're going to discuss important concepts that will help us have a better understanding of what's going on inside the heart as it generates a heartbeat. The first concept that we are going to discuss is the conduction system of the heart. Now, the conduction system of the heart is pretty much these special cardiac cells right here that are responsible in conducting signals that cause the heart to contract. The first cell is called the SA node, right here, or the sinoatrial node. By its name, sinoatrial, this cell is found within the right atrium of the heart. This is also known as the natural pacemaker of the heart because this is where the beginning of the conduction takes place. So from the SA node, the conduction goes to the AV node or the atrioventricular node. By its name, this can be found within the border of the right atrium and the right ventricle. The AV node is also known as the gatekeeper of the heart. And the reason being is that it gets to decide whether what impulse to let through. So, if the SA node generates a weak impulse or there is a block here somewhere, the AV node will perceive that and will decide not to let the impulse go through, and instead it will conduct its own impulse. So from the AV node, it goes to the single structure right here called the bundle of His. And from the bundle of His, the cells will continue and will bifurcate into two separate cells, one to the left and one to the right. And this will now be called the left and right bundle branches. And from the bundle branches, they will extend within the apex of the heart. They will be called the Purkinje fibers. So again, the conduction system of the heart begins at the SA node, goes to the AV node, next is the bundle of His, the right and the left bundle branches, and then eventually Purkinje fibers. So another concept that we need to discuss will be the inherent rate of these cardiac cells. When you say inherent rates, these are pretty much the heart rate that we generate depending on which cardiac cell sends an impulse. So for example, if the SA node starts it all and it goes all the way to the Purkinje fibers, this will generate a heart rate of 60 to 100 beats per minute. It starts from here, goes all the way to the Purkinje fibers, that will generate a heart rate of 60 to 100 up to 12. Let's talk about EKG. It has different parts. We will start with a small bump right here called the P wave, followed by this tall structure right here called the QRS complex. And lastly, the last bump after the QRS complex would be the T wave. Let us discuss them one by one. Let's start off with P wave. The P wave represents atrial depolarization. During atrial depolarization, the two atria are contracting. Next up, the QRS complex. Now, the QRS complex represents ventricular depolarization. During ventricular depolarization, the ventricles of the heart are contracting. Depolarization is for contraction. So how would you know which one is which? That P wave is for atria while QRS is to ventricles. So if you look at the diagram right here, the QRS complex, it kind of looks like an inverted V. So V for ventricles. So when you see a QRS complex, think about ventricular depolarization. So lastly, we have the T wave. The T wave represents ventricular repolarization. This is when the ventricles are relaxing. Keep in mind that every depolarization is always followed by repolarization. So for every contraction will be followed by relaxation. That being said, the question is, where is atrial repolarization? So if QRS represents ventricular depolarization or contraction, and T wave represents ventricular repolarization or relaxation, then where is atrial repolarization if this is depolarization? Well, it can be found within the QRS complex. As you can see, the QRS complex, it's a tall structure. Because ventricles tend to contract stronger than the atria, they tend to mask the atrial repolarization. And so, that being said, atrial repolarization and relaxation takes place after the P wave, which can be found within the QRS complex. Now, as a review, P wave stands for atrial depolarization. The QRS complex represents ventricular depolarization. The T wave represents ventricular repolarization, and the atrial repolarization is covered by the QRS complex. You can't see it, but it exists. So now let us talk about the segments and intervals in the EKG diagram. There are a bunch, starting off with the PR interval, the PR segment, the QRS complex, the ST segment, and the QT interval. But to make it easy for you guys, we are just going to talk about the PR interval and the QRS complex. These are all we need to do the EKG interpretation. The other segments, they are important too, but we don't really need them to interpret an EKG faster and more efficient. So this is your typical EKG strip. In an EKG strip, we have a big box. And inside a big box, we have 5 small boxes. Each small boxes is equal to 0.04 seconds. And so if in a big box there are 5 small boxes, that means that one big box is equal to 0.20 seconds. But really, as long as you know that one small box is 0.04 T wave and the beginning of the QRS complex.
And now we are going to look after the experimental setup in an clinical techniques. Let us have the concept now.
To prep the skin, we use these skin cleansing swabs, which are actually just alcohol swabs. And we just wipe down the area, wipe it down really well. This is just to remove any oils which can cause drift in your signal. And now we can place the electrode. First we're going to look for the chest leads. The important one is V1 because everything else is related to V1. The first thing I do is I find the top of the sternum, and about 4 centimeters down there should be a ridge. It's over there. And that should be your second intercostal space. Then I have to move 2 down to get the 4th intercostal space, and that will be V2, and V1 is just opposite that on the other side. Next, I will find V4, which is mid-clavicle, and just 1 intercostal space lower, mid-clavicle, place that one there. And then I'll look for V6, which is mid-axillary on the same level. It'll be over there. And then I can just fill in halfway in between is V5, and halfway between these two is going to be V3. Once I've found those spots, I can stick on the electrodes.
This is the adhesive type electrode. Okay, he's peeling the seal and he's simply pasting
3,
positions.
E4. E5.
Usually this type is
6.
utilized by it
Then we
is
can
done
take each of these wires and run them into the octal
suction
bioamp
type.
into channels 1.
In suction type is very complicated for due to some patient movement. So nowadays they are using adhesive type.
Right, now we're going to stick on the limb leads, lead 1 and lead 2. So we're first going to stick on left arm
Also, this is an use and throw type. Okay,
and try and stick it on somewhere where there is not a lot of muscle movement, because that'll just cause EMG. Put it on right arm. And then we can connect the left leg, which is the reference for all the augmented leads.
Left leg is
And
the
lastly, we
reference
can stick
electrode.
on the common, which goes to the ground input
Common electrode.
on the octal bioamp. Stick that on the right leg. An important part of getting really clean ECG data is to have the subject either lying down or sitting very relaxed in a chair, as EMG can.
So that's all with the today's video, and in the next class we will see the similar animations for EEG. Okay, thank you.